We begin with the National Labour Commission that is threatening to sue striking laboratory scientists who embarked on a nationwide strike Thursday, prompted by their colleagues at the Komfo Teaching Hospital. The Komfo Teaching Hospital scientists started the strike over what they say is imposition of 2 medical doctors to superintend their activities, sidelining highly qualified practitioners within their profession. As a result of the strike, pregnant women and other vulnerable patients have been left stranded in public hospitals across the country. Here in the national capital, frail-looking patients say they had to beg to be attended to, while some with the means opted for private labs. Others pleaded with authorities to speedily resolve the issues so that they can be attended to. My colleague Kwekwa Asante was at the Korle Bu Teaching Hospital and has come through with this report.
The nationwide strike of the Ghana Association of Medical Laboratory Scientists is biting. At the Korle Bu Teaching Hospital Thursday, scores of patients were stranded as the laboratory scientists joined their colleagues in the Komfo Teaching Hospital and other health centers in the country to withdraw their services. This action is in protest of the appointment of 2 doctors to head the laboratory unit at the Komfo Teaching Hospital. The stranded and frustrated patients have a 2-edged appeal for government to step in and immediately resolve the problem, and for the lab scientists to soften their stance in the national interest.
This is very disturbing. If someone is sick, she must be attended to. And if you say you're not working, are you saying they should go home and die? So we are pleading. They should attend to us because health issues are very important.
It's a very difficult situation because some people's conditions are very critical and they need to be attended to. Some of us, maybe I can do well to go across the street for my test, but then others are very critical and they need to. So I think if the authority can come in and then talk to them to do, save those people, I think it will be very good. It's a bit worrying, yeah, because if you can see people are very sick and they need this test to move on and nothing is working. We've not been told about any strike too.
Going to other private labs will disturb us because when the tests are conducted here, it is cheaper than in the private laboratories.
Chairman of the Korle Bu chapter of the Ghana Association of Medical Laboratory Scientists, Francis Kwachi Entry, describes the appointment of the 2 doctors as illegal.
Like it has been stated clearly, those 2 illegal intruders should be taken out. They don't have the license to practice in the lab. We can collaborate with other health professionals within the laboratory space. But if you are not licensed to practice in the lab, it's illegal. You can't do that. Otherwise, people from Mokola should also come and join us so that we work together.
He also insists the blood of any lives that may be lost in the course of the strike will be on the hands of government.
We made it clear that any blood that will go down as a result of this strike will go down on the heads of the management at Komfo and then possibly the Minister of Health, because they were supposed to have intervened long time ago. As for GMA, they will have a part to play, but it will not be as compared to the management of Komfo and the Minister of Health.
Joining me via Zoom is our Northern Region correspondent, Martina Bugiri, with the very latest from Tamale. Martina, how are public hospitals in the region taking the strike? Martina, how are public hospitals in the region taking the strike? All right, so we'll try and get to Martina to gauge the mood in Tamale of how the patients are. All right, so Martina is back online. Martina, tell me how public hospitals in the region are taking the strike.
Well, I must say that most of them are actually not working and they are adhering strictly to the terms. And so anyone in the region here who wants services, laboratory services, would have to look elsewhere. You would have to engage any private person to be able to get these services. So as we speak now, when you go to the hospitals, you will not find any lab technician or any lab scientist there. Their offices are locked. At the TTH, this afternoon, the offices were all locked. And so you go and all you'll find is an empty space, no one there.
I know you've been engaging some stranded patients at the hospital. What have they been telling you?
Most of them complain of cost. I mean, at the public laboratory is cheaper. You probably will be paying 2 or 3 times more than you would have paid at the public laboratory at these private facilities. And so most of them are complaining that they might end up not going back to the hospital because they will not be able to afford these services. Some are also complaining. Imagine a pregnant woman who would have to go to the hospital, move out of the hospital, go and seek these services and go back. And so the stress involved. But I must say that in all, the complaint has been the cost involved.
Martina Bugri is our correspondent in Tamale to the Upper West region now, where Rafiq Salam is joining me via Zoom with happenings there. Rafiq, what is different about the industrial action by the laboratory scientists in that region? Hello, Rafiq, kindly unmute for me.
Hello, the Executive Council of the Upper West Branch of the Ghana Association of Medical Science Laboratory Scientists held a meeting this morning and then went on the industrial strike. And they are saying that they are doing that in solidarity with their colleagues from the Komfo-Anokye Hospital. I visited almost all public health institutions in the one municipality, those facilities that are having laboratories, and I can tell you that they are strictly adherent to what their leaders have told them. I visited the one municipal lab this morning. The only few staff that I saw there was those who went in the night, and so they were supposed to close this morning. And so when the executive members came to them, they told them about their strike. Everybody vacated the scene, and they even locked the door. And so I also visited the regional hospital, where it was like a ghost town. Not many people were there. And also we had even chairs, over 2 dozen chairs were empty. Nothing seemed to be happening at the regional hospital. And so they are really adherent to what their leadership has told them. And so but the focus now, like Martina told you, is now on the private facilities because most of these private laboratories in the one municipality were even choked. As a midday, you can see the number of people who were there. And the patients were packed like sardines because there was really no breathing space. But they're saying that it's far better than none because they have to go there, but at a higher cost.
Here are sights and sounds put together by Rafiq Salam from WA.
That was issued yesterday by the Upper West Branch of the Ghana Association of Medical Laboratory Scientists. Members were directed to wear red armbands and also kept these bands on the entrances and also the doors of the various facilities. Gamel Emmanuel Ajuraku is the Upper West Region chair of the association.
When you come to the lab, there is not going to be any service rendered. And in fact, you not even see us at the work site, but we are not going to come here. All our doors will be closed. So we are not going to render any laboratory service. Blood bank service will not be there. Emergency service will not be there. Even reports that we write, we will not submit any reports to any this weather teams or whatever. You will not even write any report.
Many of the patients who came to the hospital and were directed to come to the lab came with their samples, but unfortunately they were turned away. With a 13-month-old baby strapped at her back, 30-year-old mother of 2, Susolo Safura, hails from Bobale in the Sisala East municipality and came to the one municipal hospital for treatment. She was then directed by a medical doctor to go to the hospital's laboratory for tests, which she did, but was turned away as a result of the strike. Where are you going now?
I'm going to the house.
You're going to the house. Are you going to see the lab test at any other facility?
Once they said they are on strike, I know wherever I go, they say they are on strike.
But what about private hospitals? They should be working.
I don't have money to go.
Another who bears the brand of the indefinite strike is 32-year-old Abdullahi Tijani, whose wife delivered through cesarean section. The wife felt unwell after the cesarean operation, and they gave him their blood samples to come to the laboratory for testing. Manager of the One Municipal Hospital Laboratory, Teresa Salifu, explained why the clients have been taken away.
We are not happy because the clients, some of them are our relatives, and our motto is service to humanity. We would love to serve, but we would not love to serve under any oppression. And that is, we need to work with rules and regulations. And according to Act 857, the lab is capable of managing itself. You need a license to practice as a medical lab scientist. And we have gone through the training, we've gone through the licensure, and we are working here. Anybody that does not have the license to practice as a lab person should not be in the lab. That is our only position. And we should be given the opportunity to head whatever institution that we are working with.
The situation at the Upper West Regional Hospital Laboratory was not different, as it looks more like a ghost laboratory. Only a couple of the laboratory scientists were spotted by our cameras posting notices on the doors, whilst over 24 seats at the waiting area remain empty. The situation at private laboratories in the one municipality is quite different. For them, it's business as usual. Most of the patients who went to the one municipal hospital laboratory and were unattended to found their way at private laboratories. One of them is Bill Medical Laboratory, who seem to be enjoying from the windfall. Dr. Nafisa Siddiqui is one of the lab scientists here.
So we are making business. Once the government sector is on strike, all clients, I'm sure, will be directed to the private sector to run tests.
So you're making it, there's a windfall?
Yes.
The full name?
Even though we are not happy about it, but we need something from them, and that is about the leadership. We can equally head our laboratories. Dr. Isaac Dere first went to the municipal hospital laboratory with samples of blood for testing, but had the door shut on him. He however found solace at the Bill's laboratory.
I have a car and I drive, so I'm wondering, those who are incapacitated, those who are disabled, and they also asked to move to a private lab to do tests, or those who don't even have the financial ability to do that, what happens? You see that we are further pushing them into a position a very disadvantaged position.
Reporting for Joy News, Rafiq Salam. Wow.
Let's now go back to where it all started, the Ashanti region, where Ohemeng Teria joins me via Zoom. Ohemeng, bring us up to speed with the strike at the Komfo Teaching Hospital. Ohemeng, kindly unmute for me.
Yes, the situation at Komfo Teaching Hospital is not different from what we are witnessing in other parts of the country. Perhaps they are the people who started this whole exercise. I must say, at the facility, the medical laboratory scientists remain at home. In previous days, that was last week when they started the sit-down exercise, it was that they will come to office but will not work. But this time around, they decided to stay out of the office. So today, my checks at the facility indicate that most of the labs were closed and none of the medical laboratory scientists were around. But before today, the regional executives of the Ghana Association of Medical Laboratory Scientists actually distributed letters asking members in Ghana Health Service, Christian Health Association of Ghana, and university hospitals and other health institutions to completely stay out of office. And this particular letter was signed by the regional secretary to the Ashanti Regional Ghana Association of Medical Laboratory Scientists, Charles Nkansa. And this morning, the association proceeded to distribute this letter to the regional health director, indicating that indeed the regional facilities at the regional level have also joined the strike action. So in some places that I checked, for instance, some of them you go and the labs will be open, but you won't find any personnel at post. But at the Menchia Government Hospital, for instance, the door was completely shut. So there was no opportunity for would-be patients or those who would have wanted to access the facility to speak to personnel at post or whatsoever. But I must say it has taken a toll on patients in the Ashanti region because facilities like Kumasi South, Menchia Government Hospital, Old Tafo Government Hospital, and then Suntreso and the rest, all these places that I've mentioned, you go and you don't meet any medical laboratory scientists at post. So what it means is that patients have no option than to access care from other private facilities. And we hope to also intervene, probably speak to the private practitioners and see how far they are also cashing in on this situation. But we already know that at the Komfo-Anokye, for instance, some patients have been complaining that the cost of medical laboratory services outside the facility is about almost twice as the cost that they used to pay at the hospital. So yes, it comes not just with the fact that they have to walk outside the facility of Komfo-Anokye and these health facilities to seek services somewhere, but it also comes with a cost.
Ohene Interior is our health desk reporting on the situation in Kumasi. Head of our health desk, Fred Smith, now joins me with a bit of a background about that. Fred hasn't joined yet. We'll get Fred to join with some background to this. Fred, if you're on, tell us what has resulted in this whole strike. All right, so before Fred joins me, let's speak with Executive Secretary of the National Labour Commission, Ofosu Asamoah. Mr. Asamoah, I'm grateful for your time. So this issue has lingered on for years. What stopped the Commission from finding a permanent solution to it then?
The Commission is at all time, ready to find a solution to it as it has been doing over there. You see, the problem is sometimes parties bring an issue before the Commission. And once it's before the Commission, the parties will plead with the Commission that they want to go back and settle. And if you are unable to settle, what is expected of you is to come back to the Commission that we were unable to settle. And for that matter, the Commission should continue. But if you take time to go and settle, you go and you don't come back for years, then you can blame the Commission that it's been with you for years. Yes, the Commission was still with the case, trying to settle. Parties pleaded to go and have settled the dispute at home. So that if they are unable to settle, it's for one of the parties or all of them, many of them, to apply to the Commission. But you don't declare a strike and say that the issue has been pending before the Commission for years. And for the docket and see, they pleaded to go and settle. So we expect that if you are unable to settle, you come before the Commission and not to stay back and declare a strike and say it is pending for years.
Well, the medical laboratory scientists have openly put their cards on the table, and you are inviting them over for a meeting. What happens if they fail to appear for the June 2 meeting?
They will appear because by law they belong to the essential service providers, and they are precluded from engaging in any form of strike. Any form of strike. So if we invite them and they do not come, either they will come certainly. But if they don't, we will apply to the court to compel them to appear. That is what the law empowers us to do.
I'm grateful for your time. Now, head of our health desk, Fred Smith, joins me with a bit of a background about the seeming friction between physicians and laboratory scientists, which has resulted in the current impasse. Fred, how did we get here?
Well, Aisha, I present to you a report I've laid my hands on. It is titled the College of Physicians. Well, it's on the letterhead of the College of Physicians and Surgeons, and titled Recommendations by the Ghana College of Physicians and Surgeons. And it follows a discussion with the then health minister on a standoff between the medical laboratory scientists and the laboratory physicians. Now, the recommendations were put together for the Minister of Health by the College of Physicians and Surgeons and its Faculty of Laboratory Medicine from the Professor Ernest Aite's report to provide guidance for its next steps in managing the problem as we have now. So it didn't start today. Now, the background to this whole thing is that the Ghana Association of Biomedical and Laboratory Scientists, those who are on strike at the moment, Aisha, they attempted to have 3 draft documents, namely the National Health Laboratory Policy, the National Health Laboratory Accreditation Policy, and the National Health Policy Strategic Plan, approved in 2013 for implementation at a time when the document had not received extensive stakeholder engagement and input, especially from the Ghana College of Physicians and Surgeons. And this led to the then Minister of Health, Sherry Aite, who had initially accepted the 3 documents, halting the approval process and the launch of these documents for the Laboratory Medicine Faculty of the Ghana College of Physicians and Surgeons to make inputs into those documents before any further actions are taken. Now, the Minister of Health later organized other stakeholders meetings for review of the documents, during which there was obvious animosity from the laboratory scientists towards the laboratory physicians. And all of these, Aisha, as I'm saying, are contained in the report presented by Professor Aite. So subsequently, laboratory scientists at the Korle Bu Teaching Hospital refused to grant access to resident laboratory physicians and consultant laboratory physicians into the labs at the Korle Bu Teaching Hospital. And their reason was that the laboratory physicians do not belong to the lab. The Minister of Health at the time, at this time, it was Alex Segbefia, who was then the Minister of Health. In an attempt to find a lasting solution to this problem, he put together a 3-member committee. And this committee was chaired by Professor Ernest Aite. And if you know Professor Ernest Aite, former Vice Chancellor of the University of Ghana. And they were to examine the issues and advise accordingly. Now, the actions they took resulted in these recommendations. Now, I present to you who should be allowed to practice their profession in hospital laboratories. It was one of the issues, so it's a question the committee sought to answer. And the answer to that is that the laboratory space is a place where historically contains many different health professionals, all with valuable roles to play in a lab setting, for instance. And that the role that laboratory physicians play, both as service providers and in research, is no doubt, as found in all hospitals around the world, very crucial at the lab. All relevant professionals should be allowed to work in the laboratory space, and no one should be kept away from performing their duties. And so on that score, that's how the Professor Aite committee settled on this matter. Now, there was a question about who can head the hospital laboratory. And the solution they provided to that is that as in many public institutions around the world, the issue of professional practice and management roles, or the headship, need to be decoupled. The success of the decoupling will depend on the individuals involved in the institutions, and where policies of running a laboratory are made by all subheads of the laboratory, all senior professionals will be able to apply for the headship of these institutions. So in line with the global practice, the professional head of the laboratory should be the laboratory physician. Okay. In this case, the doctors, as we've mentioned. So these and others are part of this recommendation which the Professor Ernest Aite committee presented to the Ministry of Health, and that's dated the 8th of February 2018. And we remain in this situation in spite of all of the recommendations. This
is a situation we'll be monitoring to the last minute. Fred Smith is head of our health desk. Earlier, we spoke with regional correspondents and executive secretary of the National Labour Commission, Ofosu Asamoah. This is Joy News Prime. So other stories.